Hey there, if you want to learn how to save money on your healthcare, listen up. I'm going to give you some tips that I have gleaned from at least 10,000 different interactions we've had with employees. My name is MIllen with Benefit Hackers. Our job here is to make this process better for you as an employer or you as an employee. So if you want to save money on your medical plan at work, this is what you do. Ready? Get a piece of paper, get a pencil out. I'm going to give you the tip, right? Do the math. Do the math. It's not sexy, but it's imperative. Do the math on what it's costing you for your premiums, what you spend during the year for your doctors and all your care, and how much risk is in the plan, how much you have to pay out of pocket to satisfy that. If you don't do those pieces, what most people do, the stats are 40% of employees just renew their plan the same year over year, even though they've had changes in their family dynamic, their health concerns, issues. We are all getting older. We have family coming on the plan. We have family coming off the plan. To think that you should just blindly do the same plan every year and just renew is foolish. Do the math. This can be thousands of dollars. If I gave you a $3,000 raise right now, just for doing the math, would you do it? That's the kind of savings that you can be generating. And people don't do the math, so they're like, oh, I just want the best plan, so I overpay and just send it to the insurance companies. Foolish, don't do that anymore. All right, so what kind of math? Get your pen and paper out. The first thing you're gonna write down is, one, how much do you pay in premiums? What's coming out of your paycheck? If you work for an employer, you're either paid weekly, bi-weekly, bi-monthly, monthly, right? Figure that out. So let's just pretend. Let's pretend my health insurance or your health insurance is $200 a paycheck and you're paid twice a month. So that's $200 twice a month. It's $400 a month times 12 months is $4,800 a year in premiums just for you, okay? That's the cost for you to get into the program. Now don't bitch and moan about it. It is what it is. Your employer is probably paying at least half of that cost for you. You're not paying the full amount in most cases. So we can work on changing it and lowering it later, but today I want to talk about how do you maximize whatever you have in front of you. Assume you can't make changes. Assume we're not working with you guys. This is what you do. First is, what do you pay? Number one. Number two is, how do you use the plan typically throughout the year? What's your interaction with the plan? Meaning, if you only go once a year to your preventive check because you're really healthy, then essentially, and you're not on any medications, let's say you don't have any prescriptions, then your expense for that is basically zero, right? You're not used to using it, so you're not a heavy user of the plan. That's the second piece. Let's say though that you have a spouse on your plan and the spouse is diabetic and has high cholesterol and goes to a specialist doctor every quarter. So 4 times a year, they're going to the specialist and maybe they're running tests and maybe there's some other things. Maybe you have young children and your experience has been, you've had a lot of broken bones, maybe some ER visits, stuff like that. So kind of look out and what do you think is a normal usage? You can't predict the future, but what is the historical pattern been? That's the second. So let's just say that might be a combination of copays. It might be a combination of things that are covered at a discount, and try to get a gauge, just quick gauge. So maybe if you're like, you would go to the specialist, I have a spouse, and so me, I go to the specialist 4 times a year. It's a specialist, that's a $90 copay, that's $180, it's $360 plus or minus. So maybe, $500 a year for usage of the plan, things I'm paying. So you got about $5,000 a year in premium, you got about $500 in what you're spending. And the third is, where is your risk? If stuff goes off track really badly and you're sick or injured, how much exposure do you have? What are you gonna owe? The point of health insurance is that there's typically a limit in most scenarios where the maximum you're gonna pay, and that's gonna stop you from going bankrupt. Like a car accident without health insurance, you're probably bankrupt. You don't wanna get there. So what you do is you look at 3 things in your medical plan: your deductible, your co-insurance, and your out-of-pocket maximum. Those are the 3 most important things. There's others, but the deductible is the amount of money you're going to pay out of pocket first. It could be $500, it could be $1,000, it could be $3,000, it could be $6,000. So what is the deductible? Let's say for you, let's say for me, it's a $3,000 deductible. So I'm gonna put $3,000 down. Co-insurance is after you hit that, how much do you split the cost? Like the insurance pays a little, you pay a little. Let's say it's an 80-20, meaning insurance is gonna pay 80% of the bill, I pay 20, until you get to the next level, which is out-of-pocket maximum. It's gonna be on your little sheet in your booklet. Out-of-pocket maximum is for you. And let's say for me, it's $6,000. So the worst case scenario is $6,000 out of pocket for me. So I take my $6,000 risk, I take my $500 that I'm gonna spend, and I take my $5,000 of my premiums. And that's what, $11,500 is my risk. Use that measurement if you have other plan options and do the math. Sometimes it makes sense to go to a different plan that actually has a little less coverage, that is less expensive, and it's going to save you money that you can put in your pocket. Sometimes moving to a different plan costs you more money because what happens on that out-of-pocket maximum, they raise that up, and so your risk is a lot higher. Look, guys, healthcare is complicated. This is a complicated process. I'm not trying to say you can solve it in a 6-minute video. One thing you want to go to is you want to make sure that you have a benefit advisor at your firm, someone you can talk to, but do the math. Let me give you a quick story. A couple of years ago, I was in a manufacturing environment, had an executive come into the room and sit down, and there were 3 plans being offered: low, mid, and high, right? They get more expensive as they go up. And I said, okay, we're enrolling you. What do you want to do? He said, stay where I am. Looked, full family coverage on the high plan, the most expensive plan. I said, great. I said, do you mind if I ask you a question? How much do you use the plan? Never. So you and a spouse and 2 children, any medical issues? Nope, totally healthy. Any prescriptions? Nope, totally healthy. No, 0, 0, 0, 0, 0. Anything coming up? Nope. Why are you on the most expensive plan? That's just what I've been on. Part of that 40%. I did the math, showed him a $6,000 annual savings. $6,000 in his pocket. Showed him how by moving, there was some risk protection, and ultimately it was their call. Didn't matter to me, but I said, look, based on what you're telling me, yeah, you could just pay the $6,000 and hope hope things are fine, or you can save that money, put the $6,000 in your bank account. So if something goes off track that's not accounted for, you have the money sitting there, but it's your money. And not an HSA account necessarily, it could just be in your savings account. Just use that money somewhere instead of sending it over. I hope this is helpful. John Millen with Benefit Hackers. I want to try to keep some real life stuff because that's the first thing we recommend. When we meet with somebody, an employee, we say, have you done the math? And it's shocking. And I look at the rate sheet and I can quickly go, okay, move to this plan, that's, oh my God, it's a $6,000 savings to them by moving. Okay, let's have a conversation about that savings. Let's look at the risk. Let's look at the usage. Let's look at the premium. Hope this makes sense. Let me know, comment below, subscribe, and if we could ever help you, let me know.